Hi, I'm Instructor Pratt with Victor Valley College's EMT program. Today we're going to be going over spinal mobilization for supine patient. PSI Pinman, I've got to delegate my partner to approach and hold the patient's head in a neutral inline position, maintaining cervical spinal immobilization. I'm going to then assess the patient for his PMSCs. I need to do this every time I splint. Got to check for pulse. Sir, can you look at your fingers for me? What finger am I touching? What finger am I touching? And capillary refill. Going to the lower extremities, checking pulse. Can you wiggle your toes for me? What toe am I touching? What toe am I touching? And capillary refill. I'm going to then assess the neck because we're going to cover it. So I'm looking for any decap BLS, which is deformities, contusions, abrasions, punctures, penetrations, burns, lacerations, swelling. Also checking for tracheal deviation, jugular vein distension, stoma, medical alert tags, and subcutaneous emphysema. Palpating the back of the neck for any step-off, point tenderness, and blood on glove. I need to size and place my C-collar, flipping out my chin, and extending this all the way as the first steps. Size and place. Okay. Now we're going to log roll the patient on headman's count.
Ready? 1, 2, 3.
And assess the back. Observe for any decap BLS, any paradoxal movement on the back of the chest, flail chest segments, sucking chest wounds, or any impaled objects. Palpating along the spine for any point tenderness, spinal alignment, and step-offs. Also going to check for a wallet and make sure that that is removed. Okay, going down onto the backboard, headman's count.
Ready? 1, 2, 3.
And Z-track is necessary.
1, 2, 3. 1, 2, 3.
Okay. Patient's now centered. We're going to observe to see if there's any voids between the patient and the backboard, and make sure that we fill those voids. Now strap in the patient, torso, legs, and then head. We want to make sure that the D-ring does not sit on the center of the sternum, as that will affect us doing any CPR. And we need to pull out all slack. Take a nice deep breath in for me, sir. Okay, you go ahead, breathe normal. Now for the legs. Okay, get that D-ring secure. If we're anticipating moving our patient perhaps downstairs or an incline or decline, we want to secure the feet to make sure that they don't slide down. We can do this by simply taking up slack from the bottom line of our strap, making a figure 8, putting it around the feet, and then tightening as we would normally. Patient's now secure with the legs. We need to make sure our head's secure using our head blocks. Head strap. And our medical tape. Our partner is now relieved of holding C-spine, and we want to reassess our PMSCs, checking the pulse. Odor, can you wiggle your fingers for me, sir? What finger am I touching? What finger am I touching? And capillary refill. Gotta go to the lower extremities, check the pulse, dorsal pedal. Wiggle your toes for me. What toe am I touching? What toe am I touching? And capillary refill. Once we complete that, we're going to transport the patient and keep them in a spinal immobilization.